So my name is Maria Thomas, and I am a South Asian woman with light brown skin and black curly hair. I'm wearing a t-shirt that says, "Let this radicalize you." And I'm sitting in a room with purple walls with a snake plant behind me. And I am here as the Beyond Do No Harm Fellow with Interrupting Criminalization. Interrupting Criminalization was launched in 2018 by Andrea J. Ritchie and Mariam Kaba as a collaborative container to weave cross-movement networks, create resources and support organizers working to end the growing criminalization and incarceration of women, girls, trans and gender non-conforming people. And my role as the Beyond Do No Harm Fellow within IC is to coordinate the Beyond Do No Harm Network, a network of practitioners and caregivers, organizers and advocates seeking to interrupt criminalization through access to medical care. And we are thrilled to welcome you all to the second monthly Beyond Do No Harm session focused on non-punitive, non-police mental health response. Now, this is a topic that IC is deeply committed to. And before we move into tonight's panel, I wanted to share in the chat some resources and offerings that IC has created around this topic. In 2021, IC released Defund Police, Invest in Community Care, a guide to non-police mental health response, co-authored by Megyang Chung, Mimi Kim, who you'll hear from later tonight, Shira Hassan, who's also here with us, and Andrea Ritchie as well, who's also on this call. The report and accompanying checklist are intended to support organizers advocating for and working to build non-police, community accountable crisis response teams. IC holds a monthly learning space for groups and organizations working collectively to intervene in and respond to crises without police. So know that there are spaces beyond this one where we can continue to grow this work together. And we'll drop links to the guide and the checklist and the learning space. And I see those links have already been dropped, thank you, in the chat. Okay, so on to tonight's agenda. Tonight, we're going to spend the first hour hearing from panelists who have been engaged in this work of building non-police crisis response and creating more affirming modes of care within and outside institutions. And in the second hour, we will have breakout groups that are based on roles in our professions where we get to strategize together in community. Now, this is an abolitionist, multilingual, collaborative learning space where we are all invited to share knowledge, expertise, but also questions and uncertainties and nuances, and disagreements even. We understand that abolition is the process that we have to engage in collectively. And although this is an abolitionist space, we cannot guarantee that there aren't people who don't work with law enforcement, who work with law enforcement in this space. So we want to be making sure that we just invite people to be mindful about what you share. And that being said, we want to build community tonight and beyond tonight. So if you feel comfortable, drop your name, your location, and professional roles you might hold or campaigns you might be part of. All right. With that, I would like to invite Asantewaa to ground us in a cultural offering and just take us into a space of poetry and creativity before we start the session. Asantewaa.
Thank you. My name is Asantewaa. My pronouns are she, her, hers, and I would like to share a poem from Love, Lyric, and Liberation, which is a collection of poems that I wrote. I heard an old woman say, "It's about time for revolution." She could smell it in the air, between the stench of exhaust pipes and cigarette smoke, she said. Watch the clock on history's wall go tick, tock. Watch the lifeless bodies of our babies falling one by one by one. They're getting tired. No more airbrush t-shirts, memorials are black ties, and the summers are hotter now. The tides are rising, their eyes are widening, rising up one by one by one. It's time for revolution, she said. Do you hear the battle cries, drums fading in the wind, the trembling fear of our enemies, knowing that once and for all that they had underestimated their captives? I got a pamphlet from an Army recruiter, she said, remembering the last draft, took 2 of her sons and the one that remains resides in a cage. These times are familiar, she said. I hope to be present when the patient lose what little patience they have left, when songs of solidarity drowned out the sounds of police sirens and helicopters. She remembers the rainbows of fists lifted aggressively in the air, her grandmother telling tales of that fateful time in June when freedom was theirs, the disgusted stares of ghost-like men who wanted her dead, but didn't know why. It's time. Thank you.
Thank you, Asantewaa. And now I'd like to invite Vinny Ang. And I'd like to extend a warm and loving invitation for all of the world building that Vinny is doing and to share with us just why it is so important to think about crisis response and to do it from a place of love, caring, and imagination, and how systems fail us when we don't do that. Vinny, thank you so much for being here.
Good afternoon, everyone. My name is Vinny Ang. My pronouns are he, him. I'm a light-skinned Cambodian American on unceded Ramaytush Ohlone land. I'm wearing a brown sweatshirt with art by Jeffrey Chung, 2 colorful figures in a warm embrace. I want to thank everyone for being in this space today and for coming into this space with your imagination and your hearts deeply connected to the power of care as a force for healing in our communities. I come to this work not by choice, I don't think. And I think many of you who work in care fields understand when I say what it means to be someone impacted by police violence. And this space is an opportunity for us to imagine something different, because we know and we live with the reality of the limited opportunities for interventions that allow our community members to thrive. 11 years ago, in an unfortunate and tragic circumstance, my sister was experiencing mental crisis. She was a refugee from Cambodia. She had come to Los Angeles when she was a young teenager in 1979, having survived the genocide of the Khmer Rouge in Cambodia. And that experience as a young individual, not yet fully formed in some ways, but also fully realized because of her humanity. There were challenges that she committed a lot of energy and time trying to find resources to care for herself. And unfortunately, her 10-year struggle came to an abrupt end in a moment of crisis where she, feeling distressed, went to one of 2 places where she had felt safe, which is the community clinic where she had been receiving care for over a decade. But she did not have an appointment that day and was asked to sit in the lobby of that clinic. And while experiencing this distress and waiting for care, unfortunately, a call was placed by the clinic operators to a non-emergency dispatch number. And as a result, 4 sheriff deputies were deployed. And in under 12 minutes, the situation escalated and resulted in quite a fatal and tragic outcome. My sister's name is Jasmine Ha Eng, and every day I imagine what this world would be like if she were still with us. And it's that space of imagination that I think you all carry with you and why you are here today, to take that imagination and to translate it into reality, because something better is possible when we care for each other in community.
Thank you, Vinny. Sitting with the weight of what you shared, but also wanting to honor the person Jasmine was, and the ways in which you and we all hold her memory dear, and hold the memories and lives of all those who have been killed under the violence of this current system close, as we fight from a belief that is deep in our bones that it does not have to be this way. And so thank you for that invitation to continue to practice other ways of being, so that such outcomes become a distant thing of the past. I'd like to invite the panelists one by one to introduce yourselves and also share how you come into the space and this conversation, perhaps the organization with you're with, and also share from your vantage point some critiques of the dominant practices in your profession that we should interrupt. So I'm gonna call on Olivia Park first. Olivia, if you'd like to step into the space and share just a little bit about how you entered this conversation. Thank you.
Hi, my name's Olivia Park. I am so honored to be invited into this space. Thank you for creating this shared time for us to be together and discuss these very challenging and critical issues. I am a East Asian woman with dark brown hair that is in a ponytail. I'm wearing a very light gray sweatshirt with an abstract black and white printed scarf around my neck. And I have a white wall behind me with some minimalist black and white art. So in terms of my professional training, I am a family medicine doctor. I trained at UCSF and medical school. I'm currently months away from completing my family medicine residency in the East Bay. I also hold a master's in public health in health policy. But what brings me here, like Vinny said, is not by choice and really has nothing to do with any of my letters or after my name. I am here as a person who lives with mental health illness. I suffer from major depression and have had several episodes, have been on 5150s, have been hospitalized several times. I spent most of my adolescent years institutionalized, either in a medical hospital or a locked psychiatric facility with other teenagers that in reality served more as a halfway house. And my best friends at that time, who I hold in my heart and think about every single day still, all were born into circumstances they had no control over. and were dealing with severe mental illness. And instead of providing and receiving the care, love, and support that they deserved, they were being let down by the very institutions that claimed to care for them. One of them, at age 14, ran away from North Carolina because his family found out that he is gay and was persecuting him. He ended up here in San Francisco and, to survive, engaged in sex work. And through that became exposed to lots of substances and started to have what doctors call psychotic episodes. And he was arrested and then was brought into this halfway house. Another friend of mine, this is in the height of the 3 strikes law, and he was 17, and it was his 3rd strike for selling very small amounts of marijuana. But his lawyer was trying to use the fact that he had a seizure disorder and suffered from trauma as a way to keep him out of prison. However, when he turned 18, that's where he landed. Another friend who came up in the foster care system on lots of substances to self-medicate the voices that he was hearing, the trauma that he experienced, accidentally shot and killed a police officer. And he was housed in this halfway house with me until the day he turned 18. And I still remember us trying to celebrate his birthday. And after we sang happy birthday, just hours later, police officers came, put him in an orange jumpsuit, shackled, and took him away. And he probably is still incarcerated. So that is what brings me here. And I see the intersections of the medical industrial complex and the prison industrial complex as really an area for opportunity, actually, that has not been tapped into.
Thank you, Olivia. And thank you for sharing so vulnerably of the various things that bring you to this conversation, and just grateful for the work that you do with Mental Health First and beyond, and the Do No Harm Coalition. I'd like to invite Mimi Kim to just pick up on Olivia's point about there are opportunities for our professions to interrupt this criminalization, to push back. So if you could share some critiques of some of the dominant practices within the profession, also how you enter this conversation. Thank you, Mimi.
Sure. Hello, everybody. I'm Mimi Kim. I'm a light-skinned Korean American woman with, I can't quite see it, but it's longish black hair, black t-shirt, and a white background. And I'm here, usually I'm here in Tongvan land in Los Angeles, and I'm speaking to you right now from Lenape land in Brooklyn, where I'm just for a couple of days. So thank you so much for inviting me to the space. I was, as we were preparing for this, I was realizing this was a space that was a little different than spaces that I'm often in that I think so many of you here do identify as practitioners in some way. I'm just going to use that word loosely, but various ways, social workers, mental health professionals, nurse, people doing medical care. I don't think that describes everybody, but I think it's a good number of people here. So really, I'm happy to be here in a space with people that are doing the work. And I know as people doing the work, we struggle with work. I come here as kind of late in the game, as identified with social work, in that I started my work in the anti-violence movement I thought I was entering a movement. I found myself entering something that still can be considered a movement. It was very much a sector, a field, an industrial complex of sorts, and certainly in working on issues of domestic and sexual violence, in one that's very implicated in the carceral system, very closely tied to policing, law enforcement, incarceration, and have spent many years both being always questioning, but being part of that system in a way, having come into the movement at a time when it was already a done deal, and seen it some ways as a necessity by some, and others as, really embracing the ways in which, police were going to keep us safe, police were on our side. Some people feeling like we as a feminist movement had really won because we actually got the police to supposedly care about the issue of domestic and sexual violence. So I feel like I've, in part because I've been doing this work many years and in different roles, that I've seen different phases of how we as a more collective group have seen our relationship with the police, but also seen the ways in which particularly people of color, BIPOC people, Indigenous people, queer people, people with disabilities, people that are targeted by the police, disciplined by social work, have really also been harmed by these systems. And in some time, in many times, this harm is fatal. So there are so many critiques to be made from the vantage point of social work. I have seen, when I was working for so many years in a domestic violence and sexual violence program, various programs, honestly, very few of us, and I at the time didn't have any association with social work, but what I saw was that people brought in as social workers often came in with this kind of training that they were bringing professionalization to a place that needed it. I think as I have gone in to get an actual education in social work and degrees in social work, I've seen the ways in which even, for example, a training on child abuse is not so much on child abuse, but
Mimi, looks like Mimi might be frozen. Is Mimi frozen for others? Okay, Mimi, we're gonna come back to you, but I just wanted to sort of pick up on some threads of what Mimi was saying, and then come back to Mimi. But just this point about how whether you're working as a social worker in anti-violence movements, in hospitals, we're often deputized to become agents of the state, right? Child welfare systems, family policing systems deputize caregivers, practitioners, health practitioners of different kinds to do what Mariam Kaba and Andrea Ritchie in No More Police talk about as being soft policing. But as Mimi points out, some of that soft policing can be fatal, and there's really nothing soft about it. With that said, I'd like to invite Erica Woodland to share his perspective from your vantage point. What are some of the ways in which your profession can enact harm, and what are opportunities as well to interrupt that?
Yes, I'm happy to go next. I'm wondering, it looks like Mimi might be back though.
Oh, okay. Mimi, did you want to close the thought and hand off to Erica?
yeah, I'm so
That-
sorry. I'm not sure what
Oh,
happened here.
fine.
Can you hear me?
Yes, you're good now.
Okay, I think I can just close out. I think that I was just, sadly, Zoom decided to stop me just as I was getting right into the critique. But I think that I was just saying how much, for example, that training on child abuse would not be as much on child abuse as it would be on how to be a mandatory reporter. And that's just one example of the ways, a pretty egregious example of the ways in which social work in particular has become so tied to the pipeline to the carceral system, a handshake with, and so many different ways in which social workers have both very intentionally, but sometimes in a very way that I think is unseen and unintended. And I think that's what we're trying to reveal, ways in which we have been part of the system of policing. I'll end there. And I know that I'll have opportunity to talk more about the openings and opportunities later. Thank you.
Thank you, Mimi. And Erica, before I pass it on to you, speaking of mandated reporting, which is such a pipeline where the police are involved, wanted to flag that our next session is going to be on ending mandated reporting and the harms of that, and how there is so much surveillance, especially during the hyper-surveilled period of pregnancy, but also, drug use and so many different kinds of things. Our mandated reporting comes into play, and then the trajectory of people's lives who are essentially just seeking care get altered when caregivers are deputized to be agents of the state. But Erica, would love to hear from you about your thoughts on all of this.
Thank you so much for this invitation, and good afternoon, good evening to everyone. My name is Erica Woodland. I use he, him, his pronouns. I am a Black transmasculine person. I have long brown hair. I'm wearing a denim button-up, and I am coming to you live and direct from my home office with gray walls, and I have a wooden screen on one side, and I am currently based on the land of the Piscataway, also known as Baltimore. So I come to this conversation, into this space, as a deep student of abolition, of liberatory harm reduction, and healing justice. And I've been working with survivors of state, community, and interpersonal violence for the past 20 years. And really I've been thinking about listening to just the folks who shared about the kind of intersection of care and control, and how so many of our so-called caring, helping professions are really about control, whether that's about controlling people's bodies, minds, but also the control of our imaginations. I come to this work also as a clinician and a social worker and a psychotherapist, and I'm deeply committed to disrupting the harms of the medical industrial complex, while also knowing that we need folks inside of that institution and in those systems to liberate tools and power and resources, much of which has been extracted from our people, so that we can advance our collective liberation. So a lot of that work lives inside of the National Queer and Trans Therapists of Color Network. We're a healing justice project that is committed to mobilizing, politicizing, and organizing QT BIPOC mental health practitioners, really being super clear that we need more therapists and clinicians who are from our community, who are actually politically aligned around abolition. And, as Mimi noted, the education that we often receive is not only not up to par, but it's very much counter to a lot of what we're talking about tonight. I have so many critiques. I'm so glad to hear that y'all are doing a session on mandated reporting, because I think that is the clearest way for a lot of us to understand the way that we collude with policing, and the prison industrial complex. And, this piece around psychiatric detention, I think, is also really, really important. In my work with practitioners who are new to the field, BIPOC practitioners in particular, oftentimes we think the only thing that we can do is engage the police or a crisis response that is ultimately going to lead to law enforcement intervention, because we're indoctrinated to have fear about the things that we know how to do, the ways that our people have always taken care of ourselves and each other outside of these strategies. And so I really think that this crisis of imagination is the piece that feels most salient to me right now in my work, because I've seen this happen with myself in these roles, but also other folks who I'm in comradeship with. We just forget all the things we know how to do when we're not in this clinician role. And a lot of what's at stake around that is, you know, it robs us of being able to connect to our own power and build power collectively with interventions moving inside and outside of the medical industrial complex. I'm also thinking a lot about the particular kind of harm that can happen when you have a clinician or a therapist doing one-on-one work with a person around helping them make meaning of their experiences of violence, in particular state violence, and how we're often trained to move clinical interventions and strategies that undermine self-determination and really just continue to fuel this idea that we're exposable and that we're not worthy to be here. And so, you know, as a practitioner who has often and always worked with folks who are most criminalized, by the time somebody arrives to me as a clinician, they've already experienced a lot of harm and abuse from medical providers, from mental health practitioners. So what does it mean for us to be holding that knowledge and historical context, and also knowing that we are representing that system, right? Everybody wants to be the cool social worker who's different than the other people, right? But that's not a real complex grappling with power and the ways that we can collude, but also disrupt.
Thank you, Erica. I just so much there, and I see so much resonance in the chat as well about the crisis of imagination and how imagination is a key part of how we move forward. And I know Fabi dropped this in the chat as well, but just wanted to uplift Kara and Erica's new book, Healing Justice Lineages. And just like Erica described now, and I'm quoting from this book, right? We must remember, because it is part of the colonialist project not to, that we have so much to draw from as we imagine care and safety without policing and surveillance. And I just encourage everyone to check out the book if you haven't, which just has just a rich treasure trove of that long lineage that we can draw inspiration from. So with that, I wanted to call Asantewaa into the space for the last answer to this first question before we move to the second one. Asantewaa.
Yes, thank you. Yes, thank you. My name is, again, Asantewaa. I'm an African-American female with long locks, currently residing in Nisenan territory in Northern California. For transparency, this is actually my first time speaking in any space since I was hit by a car a couple months ago. So bear with me if my words are not coming as clearly. I come to this particular intersection of the work because of my experience as one of the co-founders of the Anti-Police Terror Project, and also my history working as a nurse, specializing specifically in psychiatric care and emergency medicine. My organizing history definitely informs the way that I nurse or the way that I practice nursing, and vice versa. The idea that resonates with me the most is the idea of using our imaginations to cultivate alternatives, especially as a clinician, right, of sorts, working outside of those, the brick and mortar, right, apparatus of healthcare, right? How do we provide interventions that are going to be effective and cause hopefully no harm, right? And it really does take imagination to create those things. Hence, as APTP, along with a group of clinicians, did just that and sat in a room and used our imaginations to find an alternative route for mental health crisis response that was divorced from police or policing, and largely also divorced from the larger mental healthcare industrial complex. It has been fascinating work, and I find joy in sitting in spaces like this one where we're talking about alternative ways to to meet folks where they're at.
Thank you, Asantewaa. And just sending so much healing energy to you, and just grateful for your presence with us today. Maybe we can start with you for the second question. And since you're already on the split screen with me, and since you already sort of invited us, and I think that's what's been most resonant, looking at the chat and everybody's responses, right? The need for imagination. And so as we draw upon our creativity, what are the openings and opportunities for interrupting criminalization at this time? How can we be creative within these oppressive bounds? So if you could share a little bit about that, and also what are communities of support for our agitations?
Yes.
Yeah.
One thing that so there's work as like an individual, like practitioner, right? And then there's work as organizer organizations. What I find effective in my individual practice as a nurse, right, is identifying policy and procedures that might not be equitable, right? And then challenging and hopefully rewriting those policy and procedures so that when the box that kind of governs the way that we give care can be challenged, right? I think we have this notion that these things are written in stone, or they can't shift, they can't move, but they absolutely can with intentional pressure, right? I've seen that happen not just in the place where I currently work, but in different healthcare spaces where it takes an individual or a few individuals to begin to challenge policy and procedures, right? And then overall, right, when we talk about like the macro kind of lens, again, asking questions, identifying spaces where intervention is possible, and then creating those interventions have been, for instance, that's exactly what MH First is, right? It's an intervention more than it is a solution. So what do we do when we know that more people are harmed by police while in the midst of a mental health crisis? We intervene, right? We put ourselves between the people and the police, and use our imaginations to find alternatives. And then also in our learning, right, of how to care for folks, there's this super homogenous, like, one way to be well, right? One way to be healthy. And as individuals and as organizations, challenging, right, that notion that there's only one way to be well, that there's only one way to be safe, and that it really is up to the individual to determine what is safe for them, right? What is well for them, and helping folks get to that space instead of the homogenized view of what it means to be well or to be whole.
Yes, so I'm hearing so much about self-determination, dignity of risk, and allowing for more expansive definitions of what it means to be healthy, and not sort of colonialist DSM codes, right? Where we know that pathologies are used to then criminalize as well, right? And there's just a long history of folks being deemed deviant, non-normative, and then being punished for that. Vinny, I would love to go to you next. What are some of the creative openings and opportunities for us to build different?
Yeah, thank you so much, Maria. I want to lift up that we live in community with so many individuals that have lived experience and impacted by the deficiencies in systems as they're currently built. And it's important that we take the time to ask individuals when they are exposed or deeply vulnerable, what is it that you need right now? That the creative imagination may not be an imposition of your purported expertise, but a moment to just be curious, because that individual probably is looking for someone to take the time to just ask, what is it that you might need right now to feel safer? And that is a way to slow things down. It's an intervention that is non-clinical, that might return some agency to someone who's experiencing or feeling overwhelmed in a moment, to give them the opportunity to regain a bit of determination around an outcome that they probably already have in mind. And I think a lot about this whenever I imagine my sister Jasmine just wanted to feel safe in that moment. She wanted to talk to someone who she knew had been providing care to her. And I think that's really important when we think about what you refer to as the dignity of risk. You know, that dignity in and of itself is a healing process, and returning dignity and returning power back to individuals who are experiencing some form of marginalization because of the level of agitation that's been diagnosed upon them, I think is a really a really human way to approach some of these situations where we might feel very uncomfortable. You know, I don't have an answer. I don't have a diagnosis. I don't have a prescription. But what I do have is this intrinsic belief that I can find a way to love you, even if I don't fully understand what you're going through.
Yes. Chills, Vinny. I mean, and so much of this resonates just so deeply, that it is as simple and as complex as just saying, what is it that you need, right? And not necessarily having the answers, but creating, co-creating and feeling our way towards those. There's a Minnesota-based organization that, again, does non-police crisis response, relationships, evolving possibilities. And one of their taglines is loving you to the next step. So it's not, you know, it's not like a blueprint or a set of things, but it is just literally being in relation and letting those relationships evolve possibilities. And like you said, just responding on a very human level and loving you to the next step. Thank you so much for sharing all of that. And I'm going to ask Erica to come in next. And Erica, I'd love, especially if you could speak about communities of support and accountability that can help boost some of our agitations or like give it some more power, in addition to talking about like creative opportunities to push the envelope.
Yes, I absolutely. I think, you know, despite the conditions and how dire they are, one of the things that is fueling for me is just seeing how many people are like, nah, like we're not doing this anymore. And there's like such a growing conversation around abolition, or people moving interventions that are like abolitionists by nature without even having access to that language. We have more analysis that's sharpening us. We have more text. We have spaces like this. Like it's a both and. And I think understanding where we are in this historical period is really, really important. I think some of the openings are, you know, broadening the ways that we're thinking about criminalization and really looking at the ways that we are moving in carceral ways, even without the presence of law enforcement. You know, my work specifically with mental health clinicians, it's like, how do we get comfortable with the full range of human experience that people are having right now? We're living in a time of accelerating crisis and violence, and people are having appropriate responses to that. And so our job is to create containers that are expansive enough to hold that collectively, and to know that, you know, your individual therapy kind of is a setup, because that's not enough resource to hold a lot of what folks are bringing. I think there is a lot more conversation around power and what it means to be in these roles and hold power. And I think this piece around accountability is really important. At the network, we talk a lot about just being from a community does not mean you have expertise to work in that community, doesn't mean your values aligned around the things that we're talking about related to healing justice. But it's really hard to do the right thing when you're in a context where people are causing harm alone. And so what I appreciate is even being a part of the Beyond Do No Harm network, I'm learning about other formations that are moving on the ground, so I feel less isolated and less alone. And I think there's a lot of opportunities for us to think about how we link up with other people who have been doing this work. So I feel super, super excited about the moment. And a lot of what you and I just talked about, Maria, is like, how do we, things are moving really fast. And I feel like the support for what we're talking about is growing really fast. And so what are the relationships, resources, and the coordination so that we can actually function as an ecosystem? So I feel really excited about some of the like structural pieces of what's possible because of how my mind works. But one example or story I wanted to just briefly share that I still feel really proud of. The National Queer and Trans Therapists of Color Network, we were invited to be a part of an intervention along with the Latinx Therapist Action Network and Changing Frequencies and Project South to really move a healing justice strategy as part of the Shutdown Irwin campaign. So if folks will remember the Irwin County Detention Center, there was a huge expose. Whistleblower, Black nurse Dawn Wooten, really let folks know about the medical abuse that was happening and forced sterilization in that detention center, along with all other egregious harm and violence related to people's medical care. And LTAN and in QTIM, we were able to collaborate to provide a container for emotional support for survivors that was actually rooted in abolition, rooted in political analysis of the campaign, and really asking folks to think about what does it mean to use your skills in this moment, but not actually in a role as a therapist, right? What does it mean to do that ethically? What does it mean to do that with a really deep understanding of trauma in this moment? And what does it mean to do that in a space where we are getting politically educated together and we're grappling with like, how do we address concerns about safety in this container, in this context, in this moment? So I think a lot is possible, and it means we have to be comfortable with not having answers and you know, figuring it the fuck out, for lack of a better term. Like, I think there's a lot of people who we just have to try things, right? And it's a huge moment of experimentation. It's really, really exciting.
Yes. And that reminds me of just the Interrupting Criminalization Project, 1 million experiments, because that is what we'll need. And so REP that I referenced, Relationships Evolving Possibilities, and so many of the work the panelists do, they're all featured on 1 million experiments along with a lot of others. So encourage you to check that out. And also really, really, Erica, what you said about figuring things out together and having like joint containers and spaces where we can learn together, but also having more intense and deep pods where we can move towards interventions, move campaigns, and do that in relationship. And so we'll drop the pod link as well, the pod form, but in addition to having folks come through unaffiliated, we're also encouraging people to come into this space, these monthly spaces, as pods. If you're already in relationship and wanting to deepen that relationship and do some experimentation where you are, maybe it's within your institution, in a certain geography, come through as a pod, and we'll have like a separate breakout room for you. And we're excited that we have a couple of pods with us who are experimenting and thinking and doing. So thank you for that. And Olivia, if I could go to you next about what are the creative opportunities here in this moment.
I love that, you know, the theme that I keep picking up on is going beyond the boundaries that have been drawn or recreating boundaries. and that this is really an issue of imagination and creativity. I think one of the things that, you know, I love about being a part of Mental Health First is that really it works on the principle of trusting in self-knowledge and wisdom and self-determination of every individual. And just understanding that everyone has the inherent knowledge, wisdom, ability to care for themselves. And it's a matter of tapping into that knowledge and wisdom and having the resources that that individual requires at that moment, which is so counter to, you know, how physicians, clinicians are trained within the medical industrial complex. And there has been, you know, a movement, or, you know, sometimes I think maybe it's an overused buzz phrase, but now we're trying to decolonize everything. But one of our fellow Do No Harm member, she was the faculty member when we formed, has been talking about, you know, what are the elements of decolonizing medicine, you know, and one of, you know, some of the principles are going beyond the logic of individual health, understanding that health, as I think Erica may have mentioned, is an emergent phenomenon, right? We all have different definitions of it. And then understanding how history and the lines of power impact health, also known as, you know, like social determinants of health, I suppose. And seeing how like we are all individually and as pods and as systems within systems, and trying to reintegrate humans back into the greater web of life, instead of creating these very austere boundaries. You know, part of, I think, what we learn as doctors is, and maybe, and I've seen this also come up in training my friends who are therapists, like how we keep ourselves separate from the patients. And as a patient, you know, like I say, like, we don't have patients. Don't call me that. You know, we're a person that wants to receive care. Or, you know, I'm a person that wants to accompany someone in achieving their goals in health and wellness. And that those boundaries were formed, you know, when we think about how those boundaries were formed, it does, I think, come from elements of colonization. Like when we look at intact cultures pre-colonization, healers are often embedded within the community, not like we have here in the medical industrial complex, where doctors are part of the medical system. And then not only are these systems fragmented and then kept separate, but our bodies have been basically torn apart. Our minds and our brains have been decapitated from the rest of our body, so that, you know, if somebody has a mind issue, they have to go to a different facility. And what happens when somebody has a heart issue and a mind issue? Then the whole medical system kind of crumbles and is at a loss, and definitely right now doesn't know how to provide that care. But I see so many pods and organizations kind of I guess, yeah, budging into these boundaries and shifting them a little bit. And one of them, you know, I'd like to uplift the work of DPH Must Divest. And there are several members of that group here who have done amazing work in bringing abolitionist principles into hospital settings. One of them that I had the privilege of helping to work on is, you know, when we have incarcerated people who come into the hospital as hospitalized patients, oftentimes physicians don't know what power that we have to advocate for the patient. And so they're just very like concrete guidelines. A lot of times folks have the same rights that they did, you know, when they were in prison, when they're in the hospital. So they should be allowed a phone call, things like that, that really do impact a person's health, maybe not in the quote medical sense, but definitely in the whole human well-being sense. And so, yeah, DPH must divest. There's mental health first, which we really is just creating systems that aren't there to really truly care for the community. You know, one of the slogans that we use is, you know, we keep us safe. And I firmly believe in that.
Yes. We keep us safe, and there's violence done when we do that artificial decapitation of mind from body. It's a term that I hear in the disability justice community, right? Like it is the body mind, right? And it is a disservice to be making those artificial distinctions, and we need to be questioning those boundaries. And again, I really appreciate the point about how physicians, clinicians, but healthcare workers and organizers of different kinds working towards health justice give away so much power when they think that they don't have any, or don't recognize that in every situation, in every moment, there are things that can be done. And thank you for uplifting those powerful examples of groups that are doing that, right? Creating completely different paradigms of what we can build together. And before moving on to Mimi to close us out, before going to breakouts, I also wanted to, I saw in the chat, Zara Raven and Erica's point about there are so many spaces where these conversations around abolition are happening, and that's really heartening. I wanted to uplift Queenie's Crew, which is an abolitionist space and a set of resources for young folks, children who are wanting to have this conversation. I've just found it so helpful and useful, and I'm going to drop the link in the chat if you're looking to have these conversations with the young little people in your life. And gratitude, Zara, for all your work in bringing that into the world. Mimi, bring us home.
Thank you so much, everybody. I don't know if this is going to be successful. I feel like I want to channel a little bit from the energy that I just was experienced at the Beyond the Bars conference that's been here. I know it's something that not everybody was able to come to, obviously. I think it's on YouTube. But I bring it up because if we're talking about opportunities right now, there was an energy in a space. I know many of us can't be in a space in person these days, and it was rare. But there was an energy in the space that was palpable, and that perhaps sad that it was so shocking that we actually felt so much hope. We were just in having so many Indigenous leaders in the room really leading the conference, just brought a different kind of, I can't really describe it in words, but a groundedness that I haven't, I'm not sure if I ever experienced that. So many people sharing from lived experience, the transcendence of that experience, the need to palpably, to collectively join together with other people, and the experience that people had in having done that and created new things. So when I hear you talk about mental health first, for example, I know that, you know, this is not just an idea, a critique. This is a coming together of people with lived experience, with energy, with motivation, with politics aligned, with pulling together resources from nowhere to actually come up with, as you said, interventions and ways that we are doing things differently. That we now know that this is possible. I think that's what some of us were trying with creative interventions. So if you want to talk about trying to do something creatively and intervene, that pretty much was what we came up with, and didn't necessarily have a model, and just had to say, you know what, this is absolutely what we need to do. We have to do this. We have to be strategic. We have to be smart. We have to be collective. We have to take risks. We have to have each other's back. And we have to bring the life experience we have, but also some of the skills that we may have learned in the most toxic environments, but perhaps walked away with something that we have to offer in a different kind of form, with a different spirit, with a different logic, even if you want to call it that, than we were taught. And we can do that. And we have been doing that. And we have more and more people that have been naming that they want to do things differently. The critique is everywhere right now. Even among people that maybe 2 years ago wouldn't have had a critique. They have it now. Now, some of it is performative, some of it is fake, some of it is, some of those people are going to turn around and bite us. That's going to be true. This is always true. But there are so many people that have been moved. And, I just want to, people have been uplifting spaces right and left. There are spaces, I just want to name something that just came up because what they've been doing is pretty amazing, like Social Work Activist Collective, that didn't exist a year ago. And a bunch of people want to take this beyond a critique and a political analysis towards a practice. I do have to, I've been part of, I had to put in the chat there, the Network to Advance Abolitionist Social Work. We got together summer of 2020 and just said, nothing exists right now that we know of in terms of a formation, a name, something where we can really try to put together some of the ideas that so many of us have had for so long, but never even thought we could bring it to a social work space. I didn't even bother. We had just done this in independent autonomous spaces, but it was time, it's the opportunity to bring this together and create things, with each other that might not be in anything called a medical space or a social work space, but also to bring it to people that are actually motivated and have the skills in many ways to try to be part of something that's different than what they have been trained to do. I think there's so much of an appeal right now. If you look at the abolition of social work, Facebook, I mean, I know a lot of people are not on Facebook anymore, but even so, I just looked, there are 4.2 thousand people on, I'm sure they're not all abolitionists, but the fact that there's that kind of attraction to see what are people doing? What can I do? What am I already doing that I can share with other people? So I think what is really important then is to, and we have to do all these things simultaneously, right? We have to break isolation. For some of us, we were isolated for so long, but we finally found each other. I honestly had to connect with a bunch of people in New York to even be part of the network, because I didn't have that many people in California, at least that I knew of. But now I do. Now there are people, we're finding each other, we're coming up with collective spaces, we're breaking isolation, but we're also creating something new. It's probably a lot of times that we're creating something old that the system didn't want us to have, and we're rediscovering that. And we're saying, no, we're hanging on to this. We're going back to ancestors, and we are going through whatever means that we have available to really learn about what we've done for safety and healing and moving forward and going ahead and making sure that we live in a sustainable way with ourselves and with this earth, because that is absolutely the only way we are going to move into any thought of a future generation. So I want to just bring this hopefulness that I'm blessed to feel right now. I really feel like it's very real, and it is, and we have to keep that alive through feeding each other and ourselves right now. So I'm just going to end with that.
Thank you, Mimi. And I think that's the perfect